Apa cerita dia? Cuba Adam cerita sikit. Apa ni?
Tak nak.
Tak nak eh? Okeylah.
Child 1 needs lots of prompting, but only single words were heard. However, the words are only at the end of the word.
Senang sikit. Oh, dia yang jual lah. Ya. Orang ni?
Hati.
The examiner have difficulty in recognizing the words.
Awang.
Ha? Apa dia?
Awang.
Orang. Beli bawang. Okey.
Ada ujung ni.
Yang mana bawang? Cuba tunjuk kat doktor mana bawang.
Ni.
Siapa yang beli?
Ni.
Siapa? Ni. Dia ni beli.
Dekat pasar. So ada apa kat pasar? Orang tengah buat apa?
Ada bawang merah.
Child 2 was able to tell stories, but however his sentences were short and also needs a lot of prompting to tell the whole stories. Lagi dia jual apa?
Ni, apa ni?
Apa tu?
Engaging the child in conversation is a good way to assess as well as to obtain a sample of the child's ability to use words and sentences to communicate, ability to use the appropriate grammar, nouns, pronouns, verbs, tenses. The clinician needs to observe various aspects of the child's expressive language, such as fluency in delivering the information, whether the child requires prompting or has difficulty searching for appropriate words or has insufficient vocabulary and so on. The examiner is also advised to assess the child's verbal comprehension either by asking questions relating to the pictures and providing a simple instruction consisting of 2 or 3 step commands.
Observe the way the children's response to the instructions given.
Cuba Adam tunjuk yang mana satu bola warna biru. Okey. Sekali. Cuba Adam ambil bola warna biru. Cuba pegang bola warna biru. Okey. So, alright. Adam dengar doktor cakap ya. Okey. Cuba Adam ambil bola
Child 1 only able to respond to one step command.
bola warna kuning. Bagi dekat ayah.
Sekarang doktor cakap lain tak? Ambil bola kuning, letak bawah kerusi. Letak bawah kerusi. Alif. Doktor cakap, tendang bola warna merah. Lepas tu bagi pensel dekat doktor. Ambil bola merah, tendang, lepas tu bagi pensel dekat doktor. Tak dengar doktor cakap lagi sekali. And child 2 was able to perform 2-step commands but have difficulty in executing the 3-step commands. Cakap.
To assess personal social skills involves the child's ability to provide personal information such as name, age, gender, and other relevant information pertaining to the self, such as name of school, name of family members, and friends. Secondly, to perform various living skills independently, such as feeding self, dressing, toileting, and so forth. The third area is the ability to communicate and interact socially with children and adults at home and at school, as well as engage in games and activities appropriate for the child's age.
Observe the way the two children performing the task. What have you observed? Child 1 was noted to have difficulty in lacing the shoes, and also he is also noted to have difficulty in tying up the knot. As compared to child 2, He seems to be able to do the task without any difficulty. Observe the way the two children performing unbutton and button up their shirts. What do you observe? In child 1, he did not concentrate on his task, and he was noted to have difficulty in unbuttoning and seems to be struggling when doing buttoning up. As compared to child 2, he had full concentration on his task and have no difficulty in completing the task of buttoning and unbuttoning the shirt.
The clinician is required to assess the child's proficiency in executing the activities of daily living by direct observation of some of the skills, for example, buttoning, tying shoelace, putting on shoes, etc. Other relevant information such as toileting, bath routines, dressing can be obtained from the interview with the child's parents and caregivers. Throughout the screening assessment, the clinician should record the child's verbal and non-verbal social skills. Verbal skills include observing the child's ability to use language in a socially appropriate way, example, tone of voice. Turn-taking, ability to initiate, maintain and terminate a conversation. Non-verbal skills include observing the child's eye contact, gaze, sustained attention, ability to focus during a given task or activity.
Cognitive development is development of the ability of the children to think, understand and reasoning. This is the development of the learning structures and systems in the brain that begins at birth and continues throughout adulthood. This includes the construction of thought process such as memory, problem solving, exploration of objects, concept, attainment, etc. In school-age children, they should be able to concentrate for a longer period of time in set tasks, enabling them to think, understand and find reasons to simple problems. They should have greater understanding of a variety of concepts, and memory also improves dramatically. They will also start to have their own thought process and curiosity begins to emerge. They begin to discover answers to some difficult questions, such as where do we come from and how we were born. At this point, child absorbs information with ease and attain a wide range of knowledge when being exposed to. Some of the tasks that can be done to assess cognitive development include good enough draw a man test, counting forward and backwards from 20, knows left and right competently, identify days of the week, months in the year in chronological order, and understands and begins to tell the time. They will also able to follow and understand complex instruction, verbal and visual, at the age of 7 to 8 years. In the good enough draw a man test, the examiner will ask the child to draw a man. We want the child to draw it carefully, the best way that he knows how, and also to take his own time. The child will receive 1 point for each of the items which are present in his drawing. Do not include the face, that is the circle. Use the formula given to calculate the age equivalent, that is the mental age.
Bakin. In a good enough draw a man test, this is what Adam did. If you can see, there's a face and 2 eyes, a trunk, a pair of hands and a pair of legs. is equivalent to around 5 years old.
Ini apa? Rambut dia. Okey. Wah, rambut dia. Ini rambut pasien terkini. Rambut cacat In this patient's drawing, we can see there's a presence of the eye, nose, mouth, ear, hair, neck, arms and legs that are firmly attached to the right point, and also the length of the trunk is longer than the breadth of the trunk. So the total, the mental age group for this child is around 6 years old. The two children seen in the video were real students that have been referred to the doctors for failing or for being Linus Tegar. They have not been seen or assessed by any doctors before, prior to this filming. After viewing the children performing the tasks in this video, now discuss the probable diagnosis of child 1 and child 2. Give your reasons for your diagnosis.
This is a learning disability assessment tools that should be filled up by the assessor. First part should be filled up by the nurses or by the doctors. The second part should be assessed by the doctors, while good history taking from the parents and also teachers. Physical examination should be done by the doctor. Developmental and cognitive assessment also should be done by the doctor. Assessment of gross motor according to the age, 5 years, 6 years, 7 years, 8 years and 9 years. Activity of daily living, shapes, then we assess fine motor, pencil grip. We assess cognitive, good enough, draw a MEN test to assess patient mental age. Cognitive reasoning, assess speech and language in 2-step command and 3-step command. We also can refer the Linus screening tools done by the teacher by identify problems from the Linus instrument. Our main concern in terms of assessing identification of problems from the Linus instrument, we use items number. For example, intellectual disability or mental retardation, item number 7, 8, 9, 11, 12, 13 and so on until 31. Most probably the student have intellectual disability if the answer is yes to these items. And same goes to autism, ADHD, specific learning disorder, and last but not least, coordination problem. Then we proceed another tools, instrument senarai semak dyslexia, whereby the student will bring along this assessment tool that been done by the teacher at school, and it should be signed by the teachers that assess the student, and from there they will put the score. If the assessment done by school showed the score 1, 1 at this level, code 1, 1 and 1 showed that most probably this student have a problem of dyslexia. The next part, we also assess the student in terms of social and behavior aspect, whereby we look into the student strength and also weakness. We also assess the comorbidities, other problem that the student have. The last part is our impression and differential diagnosis, whereby we find out what is the type of disability that may occur in the student. After the assessor have examined and assessed the student, the assessor should sign and chalk their names.
After you have come to a diagnosis, now it's time to break the news to the parents. Watch these video clips and discuss how will you handle the situation 1 and 2 yourselves.
Cik Di pernah dengar tak yang kanak-kanak keluhan khas ni sebab selalu ibu bapa dia akan dia pernah dengar nama macam OKU lah, macam kurang OKU.
Doktor, saya macam tak percaya je dah anak saya OKU. Betul ke? Boleh cek tak lagi sekali nak pastikan
Okey.
betul ke tidak dia?
Yang mana satu tu yang Cik Di rasa?
Yang OKU tu.
Yang OKU
Ya.
tu lah.
Setelah membuat penilaian, kami berpendapat anak Encik mengalami masalah pembelajaran. Beliau memerlukan pendaftaran sebagai orang kurang upaya untuk tujuan ini.
Apa yang kurang upaya dia tu?
Jadi itu mesti ada salah seorang daripada ibu ataupun ayah yang...
Saya dah beritahu doktor, dalam keluarga saya tak ada yang OKU. Apa doktor? Balik-balik OKU, balik-balik OKU. Kamu tak dapat? Ha? Kenapa tak dapat? Kena bimbang tu risau. Belah tak doktor?
We sincerely hope that this video would be beneficial to help the clinician in assessing children with learning difficulties. It is only meant to be a guideline, and we encourage you to use your clinical judgment and conduct other necessary assessments as required before making a decision. My name is B.G. Chandran. I'm a clinical psychologist and I have been working with children with learning difficulties for the past 29 years. Assessing children referred for learning difficulties is a very challenging task. We hope this video will provide the guidelines for clinicians and doctors who are given the task of assessing children with learning difficulties referred by the schools. This screening instrument is intended for children above the age of 6. This has to be supported by observations of the child's behavioral achievements in 4 main domains, i.e. gross motor, fine motor, speech and language, as well as personal social skills. This would provide a profile of the child's strengths and difficulties in each of the 4 domains and enable one to obtain an approximate developmental level of the child's status in the gross motor, fine motor, personal social and speech and language domains. We are now going to demonstrate how to perform the screening assessment on 2 children referred for learning difficulties. The assessment would involve the 4 main domains, i.e. the gross motor, the fine motor, the speech and language skills, as well as the personal social skills.
Assalamualaikum. Adam, apa khabar? Adam ya? Okay, Adam duduk. Encik, ini nama Encik?
Ahmad.
Encik Fiza ya? Okay. Adam okey hari ni? Encik ada bawa dia punya senarai yang kita suruh bawa tu? Okey.
Terdapat 3 manual instrumen yang diguna oleh pihak sekolah dalam pengesanan murid bermasalah dalam pembelajaran. Pertama adalah manual instrumen pengesanan murid bermasalah dalam pembelajaran yang dikeluarkan oleh bahagian pendidikan khas. Kedua adalah manual instrumen senarai semak disleksia juga dikeluarkan oleh bahagian pendidikan khas. Dan ketiga adalah manual garis panduan pendaftaran orang kurang upaya itu OKU yang dikeluarkan oleh Jabatan Kebajikan Masyarakat. Instrumen ini perlu dinilai oleh guru dan perlu dilengkapkan serta disahkan oleh guru yang menilai.